we've tried to pick the questions that would most allow for interesting discussion between our panelists as opposed to more specific stuff on their lines of research. So this first question is more of a broad question to the whole panel, but from your perspective and from the perspective of your field, are we ready for long-term missions, i.e. either in space or to the moon or to Mars or to further to Mars? So anyone who feels like that they have a good answer, you can just go ahead and we'll go from there.
I can start.
Yes, sure.
I don't think that we are prepared for long-term space missions or deep space missions. I think that we are, in fact, after being in this field for 30 years, I have to say that I think that we are not doing a good job. We are not integrating studies. We are, as I mentioned in my presentation, we have male data, not male and female data. We have poor ideas in relation to how medication work in space. We just basically use the same dose and time interval of medications that you use here on Earth in space, which is very poor. We integrated physiology in terms of studies are also very poor. I don't think that we are prepared, basically. I think that we have huge gaps in terms of knowledge. And I'm saying that, and I'm sad, in fact, because when I started my studies, when I was young, enthusiastic and young in the 1990s, I could see, let's say, that the space engineering, for example, it evolved so much, genetics, artificial intelligence, telehealth, digital health, and we are still struggling with very basic problems, I believe. So I think that the community, the scientific community of space life science scientists should revisit the way that we are designing our studies. For example, I spent a long time building space analogs and using them. Like in space agents, you have head-down tilt, and you have body suspension devices, and lower body positive and negative pressures box, and clinostat, and so on. But are we really simulating space? Are we really extracting data that can be then extrapolated to a space mission? And I'm telling that, and I'm still working with that. So I'm criticizing myself. I'm not criticizing, the others, and I'm criticizing myself. So I think that it is we are not prepared. That's my position. I think that we can go and can be successful even. We did that. We did that in the 60s when we went to the moon, and we had less knowledge, we had less technology, and somehow the Americans were successful. But I think that based on the knowledge that we have, if we were honest enough, we do not have enough knowledge to assure that someone will go to Mars, for example, spend time there and come back safely.
So the rest of the panel agree with that sentiment, or do you have any points to the opposition?
I mean, I would agree with that sentiment. I mean, I'm fairly new into the industry, but when I started the ESA Space Science Roadmap, we were actually struggling with just the title of the group. We couldn't agree on pharmacy or pharmacology or pharmacotherapeutics and pharmacological countermeasures was what we started it. So it just shows how much it's in infancy that we know about medications, that we even just had a long conversation about what should we call ourselves, and there is not a clear international harmonization of how this should be used. I also think that there's a lot of secrecy because we cannot solve the confidentiality of the health of the astronauts. I think there just needs to be a bit more transparency for researchers to have the data, to make conclusions and to collect more data. So I think we can do it, but I'm not sure if we can sustain to be in space. That would be my take.
So I'd like to highlight what Lee just said. As I mentioned in my talk, we were recently running a meta-analysis of the studies in terms of the effect of spaceflight on brain and behavior. And it's impressive how small data are open and available to other scientists. So in other fields, replication crisis is a big thing. Sharing data and open science are big points, which looks like in terms of the space exploration is still quite behind. And I don't really understand why. And I think that a joint effort in making all our data open might help a lot with in solving the issues that Thais was pointing out earlier.
Great, thank you. Okay, so for our next question, this one comes from Martina, and she's asking, can you provide a few examples of exciting technologies that you see as needed for space and translatable into applications on Earth, i.e. in rural or remote areas?
I guess I touched on one of those just towards the end of my talk, which is a relatively new technology called pupillometry. More and more of what we do, I think, needs to be non-invasive, and that's not, you know, within the clinical environment particularly, but in any environment, the safest way of monitoring any patient is through a non-invasive technique. There are an awful lot of invasive techniques that are available to monitor the brain, for example, but they come with risks because they're invasive. But a technology like pupillometry is completely non-invasive, quick, and semi-automated, and it gives you an idea of what's going on in the brain, because the pupils are give you so much information about what's happening inside the brain, and what the pressures are, what the pressure changes are likely to be, and you can track and trend that data over time, and you can utilize it not just for sort of acute diagnostic issues, but also for monitoring when the brain is recovering. So for example, in concussion episodes in elite sportsmen, you can use what's called the latency period of the pupil, so the time that it takes to after it's been stimulated and then it expands, for it to return back to its normal size again. In patients who've had mild traumatic or moderate traumatic brain injury, concussion type episodes, the time that it takes for the pupil to start behaving normally again in terms of its latency can be somewhere from 10 to 45 days, maybe even longer. It's certainly been studied up to 45 days. And so that information can be used to tell you when things are starting to improve again. And that's because we can't do blood tests in space. We can't feasibly be doing urine biomarker. Well, we could, but there are practicalities and practical problems with doing these sorts of trying to do these sorts of tests, not only in terms of the practicalities of carrying it out, but in terms of the sensor devices that you'd use to try and get quick results. So I would in answer to that question say that a pupillometer has a lot of potential for giving you a lot of information about what's happening inside the brain in a non-invasive and simple way, and that information can be communicated back to doctors terrestrially to perhaps advise on how that person should be managed from that point onwards.
If I can complement with my experience during my PhD here in London in the 90s, I was using microgravity simulation, hypoxic exercise, and I was testing lung function. And one of the let's say the measurements that I had was arterial blood, and I tried to compare with arterial blood in space, and there is no blood collection, arterial blood collection in space. So they use the gases that we expire, to have an idea of our arterial blood gases, for example. And so after my PhD, I developed a blood collector that can take blood from the earlobe. So it is the technique was invented in 1940 something by two British physiologists, but could be very messy in space because you have to cut the earlobe after making it full of blood and then collect the blood. And I developed this specialized syringe, let's say, that is a blood collector for the arterialized blood from the earlobe. And this is a good way, for example, to translate what is developed in space to applications here on Earth in medicine in any area, because it takes the whole procedure of collecting the blood and having the blood analysis. It is 5 minutes, and it's arterial blood that gives you lots of information that sometimes the venous blood does not give. And I have the patent for that, and it is, we developed it over the years. It started very big, 600 grams, and now is 18 grams. So you can put in your pocket and use it with your patients.
That's really interesting. Yeah, that is really interesting. I guess the issue then is what you're going to measure. What biomarkers would you measure? I think only a small number of biomarkers of brain injury have been looked at in astronauts. Some neuronal markers, some glial cell markers, neurofilament light chains. I think as neuronal marker, glial fibrillary acidic protein as a marker of astrocyte damage. Beta amyloid protein, I think, it's been measured. But we still need to, I think, all work together to try and define what are the best biomarkers, the most sensitive and specific ones, and also what the threshold, what the cutoff high versus low values are. And then, of course, what we would do if we had a positive or high result. All these protocols need to be thought through and developed, and it's no easy task. But certainly biomarkers may be in conjunction with, so you've got bloodborne information and so blood biochemical markers and physiological markers from the pupil together, along with a clinical assessment, might be a stronger, more robust panel or set of information together than any of those three on their own.
No, for sure.
Nice, thank you. Okay. So for our next question, this is from an anonymous person who said, okay, what is the possible disease burden that may be triggered by space traveling that may likely pose health morbidities within people on Earth? Are there research insights on how to manage disease transmission and infectivity within astronauts?
I really couldn't hear the last part of the question.
Sorry. Okay. I'll read the whole thing again. What is the possible disease burden that may be triggered by space traveling that may likely pose health morbidities within people on Earth? Are there research insights on how to manage disease transmission and infectivity within astronauts?
Well, the last part of the question is related basically to the immune system and how the astronauts react to possible germs like a virus or bacteria and fungal. It is interesting that it is well known now that the immune system decreases in space, so it is less active if you compare with here on Earth. But although they are in a confined environment and with lower immune response, they do not seem to present lots of, they are not more prone, let's say, to infections. They have infections. There are reports of intestinal gastroenteritis and skin infections, but the hygiene is very poor somehow because there is no shower in space. That's something that I don't understand. We are talking about going to Mars and we cannot have a shower in space, but in any case, I understand the logistics, the problem, but no solution, for God's sake. And in terms of diseases in space, it is because nowadays we still have astronauts that are extremely selected. The selection process is so intense for their mental health, their physical health, so that when they go into space, in terms of diseases, it's not the main issue now. In terms of correcting myself, now that I attend the lecture of Dr. Scott, awesome lecture, by the way. So because we always say adaptation, it's acclimatization, so it's wrong that I spent like 30 years saying it wrongly, sorry. But in any case, because you change your anatomy, not just your physiology, your anatomy changes in space, your physiology changes and your psychology changes. When you come back to Earth, we know that after 438 days, that's the record of Valery Polyakov, a Russian cosmonaut, we can basically readapt or reclimatize, that's the right word maybe, to Earth, and without morbidities. No? But can we stay longer? I think that one proof that we don't know much is the awesome lecture of Dr. Scott, that I think that the 5 questions that he has, nobody can answer for sure. Anything. It's just suppositions.
All right, thank you. Okay, so I've got another question from Doug Plata. So this might be more so Dr. Solomon's remit, but other people as well. But in terms of establishing colonies on other planets, is the possibility of using frozen embryos being is it a seriously considered option at the moment?
That's a good question. I mean, I think the possibility of having frozen embryos could solve some of the potential problems, of course, but you still have to have successful implantation and gestation, pregnancy, childbirth, child development. So I think perhaps, but clearly we need to know much more about those other steps first. I mean, there's been a lot written about the possibility of frozen embryos for deep space, deep space travel, deep space exploration beyond our solar system. So perhaps some baby steps to the moon and Mars might be warranted before embarking on the trip to Alpha Centauri. But I think the principle is at least conceivable, but so to speak, pardon the pun. But we need to make sure that all of the other steps will work before it makes sense to even consider it very seriously.